Bacterium tuberculosis is the causative agent of tuberculosis, a contagious infectious disease that has been increasing due to many factors, such as the HIV pandemic. About 5 to 10% of people infected with TB will eventually get symptoms and develop TB disease. A total of 1.3 million people have died from TB in 2022. Worldwide, TB is the second leading infectious killer after COVID-19. Mycobacterium tuberculosis was first discovered in 1882 by Robert Koch. The disease was also known as Koch's bacillus. His investigations into the etiology of tuberculosis uncovered the pathogen. Due to his achievements in the field, Koch was considered the father of the scientific study of tuberculosis. In addition, he introduced tuberculin, which was proven to be ineffective as a cure but became very important part of diagnostic testing and management of tuberculosis. Mycobacterium tuberculosis enters the body through inhalation, and humans are the only known reservoir. Most commonly, it will affect the respiratory system, but other body systems may become involved, such as the GI system, the central nervous system, musculoskeletal system, and the liver. The bacterium has a myocylic acid to its outer shell wall, which makes it resistant to quick immune detection. Tuberculosis is highly aerobic and requires high levels of oxygen to survive. In addition, the portal of entry and exit will be via mouth, nasals, breaks in the skin, and other mucous membranes. When TB is inhaled, it passes into the smallest and lowest parts of the airways. Furthermore, the mode of transmission is by coughing and sneezing, releasing the bacterium. TB infection happens in 4 stages: the initial macrophage response, the growth stage, the immune control stage, and the long captivation stage. In addition, these 4 stages will happen over the course of 30 days.
Tuberculosis exerts a diverse impact on organs and organ systems, extending beyond the respiratory system. In pulmonary TB, the primary manifestation are the larynx and trachea, leading to extrapulmonary TB. The dissemination through lymphatic channels can result in lymphadenitis, affecting regions such as the neck, abdomen, and groin. TB's involvement is not limited to the respiratory and lymphatic systems. It can also extend to the central nervous system, causing meningitis and the formation of tuberculomas in the brain and spinal cord. Skeletal TB, known as Pat's disease, affects the spine and hips and knees. TB can manifest also in organs such as kidneys, GI tract, and genitourinary system. These systemic involvements underscore the complexity of TB and its potential to impact multiple organ systems. Tuberculosis poses a multifaceted global dilemma with a pronounced burden in low and middle income nations. Fluctuations in TB incidence are influenced by diverse factors such as socioeconomic status, access to health care, and prevalence of risk factors within populations. The emergence of the drug-resistant TB strains, notably MDR-TB, and extensively XDR-TB, amplifies the complexity of the situation. These resistant strains demand prolonged treatment regimens and are linked with heightened mortality rates, emphasizing the critical need for robust interventions. TB-HIV co-infection complicates disease management, leading to adverse outcomes and posing additional hurdles in disease control efforts. A holistic approach addressing both medical and social determinants is essential for effective TB and prevention on a global scale.
Now let us move on to signs and symptoms. First, let's talk about latent TB. Latent TB, there is no clinical symptoms, but if you get tested for TB skin test or blood test, it will show positive result. And the TB bacteria cannot spread to other people. Latent TB, it can remain inactive for a lifetime, but if the individual doesn't have strong immune system, it can go from inactive to active. Active tuberculosis. For active tuberculosis, the individual will feel fatigue, tiredness, persistent coughing with phlegm or coughing with blood, chest pain, loss of appetite, weight loss, and fever. And during nighttime, they can also feel night sweat. Thank you. Now let us move on to morbidity and mortality rate reported in the United States in 2021. In 2018, there was 8,998 TB cases reported and 542 TB death cases. In 2019, there was 8,809 TB cases, which is 1.6% lower, and 526 TB death cases, which is 3.4% lower compared last 2018. In 2020, there was 7,171 TB cases reported, which is 20.2% lower compared to 2019, and 600 death cases, which is 13% higher compared to 2019. In 2021, there was 7,882 TB cases reported, which is 9.8% higher compared to 2020, and there were 602 reported death cases due to tuberculosis.
There is tremendous work ongoing in developing safe, efficacious, tolerable treatment regimes. Goals of treatment are not only to eradicate the disease, but to also prevent long-term morbidity. Successful treatment of drug-sensitive TB has been reported in 85% of the patients. Efficacy in drug-resistant forms is lower at 57% and is likely due to a multiple number of factors or causes. There has been a trend towards oral drug prescriptions, which also highlights patient preferences and the cost-effectiveness of said medications. Treatments for Mycobacterium tuberculosis will depend on whether a patient has latent or active infection. Latent infection is when the bacteria is present in the body, but there are no indications of TB and is not contagious. This occurs when the immune system inhibits the bacteria from growing. Treating a latent infection can prevent an active infection, and providers may prescribe antibiotics to be taken over a course of 3 to 9 months. Active infection is when the bacteria multiplies, leading to an indication such as chronic cough, chest pain, and can be contagious. Antibiotics are given for those with an active infection, but doses may be increased and taken for an extended period of time compared to latent infection. According to the images on the right, active TB bacteria are awake, you will feel unwell, and you could pass the TB to others. Symptoms of active TB includes cough, fever, weight loss, loss of appetite, night sweats, and tiredness, whereas latent TB are asleep and you do not feel unwell, so you feel all right, and you cannot pass the TB to others. Some antibiotics can cause side effects ranging from nerve, liver, or eye damage. Mycobacterium tuberculosis also may become antibiotic resistant, and patients may develop drug-resistant TB, but there are longer and higher doses of antibiotics available to address drug-resistant TB. It is paramount to complete the full course of antibiotics. The chances of bacteria surviving increases the likelihood of drug resistance, which causes recurring illnesses, lessens the efficacy of antibiotics, and is very contagious. Drug-resistant tuberculosis remains a public health crisis, and about 0.5 million people will feel ill with drug-resistant TB, and only 1 in 3 people have access to treatment. Below are common antibiotics to address Mycobacterium tuberculosis. One is rifampicin, which is an antibiotic used to treat several types of mycobacterial infections, such as Mycobacterium avium complex, leprosy, and can be used in combinations with other antibacterials. Some side effects for this is hepatotoxicity, nausea, dyspepsia, abdominal pain, and rash. Another common antibiotic is isoniazid, which is an antibiotic used to treat mycobacterial infections, most commonly paired with other antimycobacterial agents specifically used to treat active or latent tuberculosis. Side effects of this includes hepatotoxicity, peripheral neuropathy, optic neuritis, and hepatitis. And last but not least is pyrazinamide, which is a highly specific antibiotic that is only active against Mycobacterium tuberculosis. This antibiotic kills and stops the growth of this specific bacteria, and side effects include gastrointestinal disturbances, hepatotoxicity, and gout. To reduce the risks of acquiring tuberculosis, prevention techniques include following your doctor's prescribed health plan if with latent infection, avoiding extended contact with people that have active infections, and to wear an N95 respirator mask when exposed to Mycobacterium tuberculosis. Vaccination for TB is not usually recommended in the U.S. However, according to Centers of Disease Control and Prevention, otherwise known as CDC, there is a low risk of Mycobacterium tuberculosis in the U.S. It could still be administered to those with high risks of exposure, such as healthcare workers or patients exposed to drug-resistant TB.
According to the National Institute, in conclusion, tuberculosis